Dr. Alexander, if a person is young and healthy and has a strong immune system already, why do they need to get the vaccine?
Well, I think a direct answer to that, Megan, is that young people actually do get the virus, the coronavirus. Young people have been hospitalized. Young people have died, not at the rates at which older people are going to be hospitalized and be intubated and die, but they are dying. I think we need to understand this is a global epidemic, meaning this virus has affected people all around the world. And I think we need to understand it is a multi-generational infection, meaning infants all the way through people 100 years old or older can actually be infected by the virus. But young children actually do get hospitalized. Right now, we're a little concerned as the rates of young people 11 and younger are increasing as other age groups are going down. So, again, this is going to be a virus that infects everybody. And I think it's also important to understand that within getting both the vaccine and having had the virus, you can continue to spread it. And young people, because they're more asymptomatic, tend to spread faster. So if you're young, you take the risk of coming home infecting mother, infecting grandmother. So very contagious. Virus loves people. It's global and everybody is at risk.
And it's true also that it's unpredictable how each individual will respond to the virus. I mean, I've had patients where they tested positive, but they had very little symptoms. And then I have somebody else who's like actually just a year older than I was, and basically is very healthy. And then now he has permanent lung damage. So it's hard for us to predict who will get very sick and who doesn't. But what I do know is that this vaccine will protect you and will decrease that risk for being in the hospital and dying from COVID-19.
And I will piggyback that, in my patient population and in people I know, anyone who has been sick from this virus at any level sick, this is teenagers, this is young adults, say they would wish that particular sickness, that the feeling that they have with this illness and coronavirus on no one. It is just not something people really, get through as without being somewhat scarred in terms of their neurologic sense about this is a very uncomfortable virus.
And that's absolutely right. Because if you think about it, the inconvenience of having a little muscle ache, maybe fever or a headache of 2 days for a vaccine versus long-term outcomes of COVID, you've heard of those long haulers. I mean, I have patients right now who've had COVID 3 months ago. They still have difficulties walking from the kitchen to their bathroom. So 2 days of inconvenience from the vaccine versus months or even a lifetime of disability from COVID-19. I mean, the choice is very clear. Please get vaccinated.
And then what about people who have already had coronavirus? Should they also get the vaccine?
The answer on that is yes. Probably one has heard about variants. We are very concerned that some of the new variants may be able to come and then infect people who both have already been infected by coronavirus. And we're a bit concerned that it may even require that we have a booster for the vaccination. That those studies are still ongoing. And then we also have to remember that everyone who gets vaccinated is not going to necessarily be completely free of perhaps getting a milder case of coronavirus. So again, that is another reason that if you've had coronavirus infection, it is wise to get the vaccine to further protect you from variants as well as getting coronavirus again.
Right, and we don't know what people's antibodies levels are after they've been infected, and it's been 3 months out, 6 months out, or 9 months out. We know that for sure that the levels do decline after 3 months from infection. And they are recommending, the American Advisory Committee on Immunization Practices had been recommending people who've had coronavirus to go ahead and get vaccinated.
And I think also important, and this may be a good segue, Once vaccinated, do not presume you may not also be infected with coronavirus. There are a few people, when they get vaccinated, they've been exposed and they actually are symptomatic. In one of my institutional settings, we've had several cases of people who were vaccinated, came to work, had symptoms, and indeed tested positive for coronavirus. So it's possibly vaccinated at the same time you actually have or are getting the coronavirus in your system. And once vaccinated, you can spread. So remember, it is going to be 6 weeks from your first vaccination before you're able to kind of feel 100% or close to 100% safe that you do not have coronavirus.
That's good to know.